Alright, so for this video, we are going to assess the nasal structure of our patient. So first is we are going to inspect and palpate the external portion of it. So in this external portion, we are going to note the nasal color, the size, if it is symmetry, and then the shape, and then the consistency, and also the tenderness of it. So now, as you can see, the nose of our patient has a consistent of the color. So I'm gonna document this. Right? So, and also with the rest of the face. Same ragapon siya. So, symmetrical ra po ang iyang nose of face. Here. Extra. Then, it is smooth. Right? Smooth. And then also, there are no tenderness or some lesions that are noted in his nose. So, it means that the nose of our patient has a normal finding. So, now we are going to proceed the patency, and then this is how we do by inspecting and palpation. So I'm gonna put my hands on here, and then our patient will gonna, if it is able to sniff or and then also to blow. So it means it is a normal finding. So sir, can you please blow or sniff also? Alright, so here blows. Alright, so I'm gonna put it in. So, our patient is able to sniff and then also blow through each nostril. So, while the others is occluded. So, it means that for this test is that our patient has a normal finding. So, now we are going to inspect the internal portion, which is to examine the mucosa, the nasal septums, nasal passages, then and also the color consistency, and then the lesions if there is, and then note for position of nasal septum. So now I'm gonna use some pen light. Alright, some pen light, and then I'm gonna alright, there's her. Okay, so nasal mucosa is dark. So, and then also, there's a pink or some moist in it. Okay, sir, sige. Okay. So, they are free of oxidate where the nasal septum is in midline. And then, it's also intact and free of ulcers or perforation. Because her. Alright, symmetrical also. So, our patient's internal portion of the nasal structure has a normal finding. Alright, so for this process, we are going now to inspect, palpate, and percuss the cyanosis of our patient. So first is we are going to palpate the frontal maxillary of our patient. So as we palpate now, we are going to do it like this. Then also, naisakit, sir?
Wala.
So next, after palpating the frontal maxillary, we are going to palpate also the maxillary cyanosis, which is here. Sakit, sir?
Wala.
So after palpating the maxillary cyanosis of our patient, we are now going to percuss the frontal cyanosis of our patient. Okay. This. Okay, sir?
Wala.
And after that, by percussing the frontal cyanosis, we are now go to percuss the maxillary cyanosis of our patient. Can I say it?
Wala.
So now I'm done palpating and percuss. So we are now going to document the findings to our patient that the frontal and the maxillary cyanosis are non-tender, and then also do the palpation and percussion. So that's it. So it means that our patient's cyanosis has the normal finding.